Let's now talk about organisms, particularly bacteria, that cause atypical pneumonia. The first one is caused by Mycoplasma pneumoniae. Mycoplasma are the smallest free living organisms. They cannot be seen on gram stain because, if you remember our introduction to microbiology, they do not have a cell wall. And it is also only the bacteria with sterol in the membrane. Mycoplasma pneumoniae is a facultative aerobic organism, but it grows better in an aerobic environment. So that's why it prefers places with high oxygen flow, no? Like the lungs or the airways. Okay? So it is a prominent cause of atypical pneumonia, especially in persons 5 to 20 years old. It is transmitted from person to person by means of infected respiratory droplets. Once inhaled, the bacterium attaches to a respiratory epithelial cell in the airway, for example, through its adhesion protein P1. This makes it more difficult for mucociliary clearing mechanisms to remove it. The incubation period ranges from 1 to 3 weeks. Illness usually begins and progresses gradually with malaise, fever, headache, sore throat, and cough, which is initially non productive, but later it may be blood streaked and may present with chest pain. But that is later. Mycoplasmal pneumonia is generally a mild disease. It causes an atypical pneumonia because of the normal PE findings, despite the striking consolidation or extensive patchy infiltrates on the chest x ray, which actually resolves in 1 to 4 weeks. When you are able to see an x ray of a patient with mycoplasmal pneumonia, you will actually get scared when you look at the x ray because of the extensive infiltrates. But when you look at the patient, you will be amazed because the patient is chill, wala lang. That's why it's also called walking pneumonia. Complications are not common, but hemolytic anemia may occur. Diagnosis is largely made on the basis of being able to recognize the syndrome. What syndrome? A mild respiratory illness despite extensive infiltrates on x ray. So, again, that's the reason why it's an atypical pneumonia. Remember, mycoplasma do not have cell walls. So, antibiotics that act on the cell wall, like penicillins and cephalosporins, they won't work. Okay? So, macrolides, quinolones, and tetracyclines are used instead. But actually, many times, the illness is mild and it is self limiting even without the antibiotics.